concern that Americans who are testing positive but doing so on at-home rapid tests aren't reporting that to government agencies, so the case counts right now might be dramatically lower than what we're actually seeing for spread across the country?
Yeah, it's a really good question. What I would say is, first of all, I'm a huge fan of home tests. I think they're convenient, they're cheap, it's great. One of the problems of home tests, really the major problem, is that they don't often get reported. So we do have, through this NIH effort called makemytestcount.gov, I think, that people can report their tests. But we have other mechanisms we use to monitor infection levels. So for instance, wastewater gives us very good insights into how much infection there is in a community. So we have seen case numbers often be lower than what you might expect if people were doing more PCR tests or more public health tests. But we're tracking infections through other mechanisms. And obviously we're tracking infections and hospitalizations so that gives us a very good sense of the burden of disease as well. The last point I will make is when people test at home, if they test positive, the first thought every single American should have is, am I eligible for treatment? The truth is, we have fantastic treatments. Anybody over the age of 50, anybody with chronic disease should get evaluated. Personally, as a physician, I think it's very clear to me that anybody in their 60s or above should be treated. Like, there should be a good reason not to treat somebody. And they're rarely a good reason, meaning most people should be getting treated right now. That is a message we've been delivering to doctors and nurses. That's a message we've been delivering to the American people. If you get a positive test at home, stay away from others so you don't infect them, and get evaluated to get treated.